While prescription opiates offer patients significant potential relief for chronic severe pain that can improve their quality of life, their use is not without risks. It is estimated that 2.1 million people in the United States currently have prescription opioid abuse disorders, while 591,000 people are addicted to heroin. Now in recovery, Betty decided to become a patient advocate as a result of her experiences with prescription opioid addiction.
There are new guidelines that have come out nationally, as well as some states have been very proactive in establishing guidelines. Everything from Washington State, they don't let people leave their emergency rooms with more than 8 to 12 pain pills. The physician who undertakes a patient who is in the kind of condition that requires chronic pain medication for many years has got to understand that there are other things that he's going to have to do other than just giving a prescription every month.
Dr. Sprints, who is trained at Johns Hopkins Medical Center and the MD Anderson Cancer Center before opening his own private practice, also has personal experience with both drug and alcohol addiction in his own life.
I've been in recovery now for over 16 years from drug and alcohol use, and I actually started early in life, about 13 years old, and just progressed like addiction does progress, and it progressed all the way to opioids, illicit drugs, etc. Most doctors in general don't have training or education in addiction medicine, meaning they don't know how to identify patients who may have a problem. And when you talk about pain, the pain experience is something that's not just physical. It's physical, it's emotional, it's psychological, it's spiritual. There's all of these different aspects to pain and how we experience pain. It's always concerning when someone walks in the door and says, "Fix me," because that means that they don't want to, that they at least currently don't believe that they have a role in this. I do have a number of patients in my practice that have both chronic pain and addictive disease. And some of them are in recovery and some of them are not. Not a lot of us out there that are really well versed in both managing patients with chronic pain and addictive disease at the same time.
Let's go to Kansas City, Missouri, where we'll introduce you to Rochelle.
So I went in early in the morning, had the surgery, was released with my prescription of pain medicine. Here you go. This is what is, this will help. That's it. I really didn't have any knowledge at all about addiction or all of the meaning to addiction.
Rochelle lives in Missouri, the only state left in the country without a mandatory prescription drug monitoring database. It was the lack of a state prescription drug registry that monitors opiate prescribing that helped allow Rochelle to doctor shop for prescriptions. When she entered recovery, Rochelle learned that if Missouri adopted its own prescription management database, she might have been referred for addiction treatment a lot sooner.
If they had a registry, then they would be able to shut it off. They would be able to turn them away and probably prevent a lot of things. A lot of crime, a lot of addiction.
Dr. Forrest Tennant is a physician who has specialized in treating pain for more than 40 years. A former medical officer in the U.S. Army and the U.S. Public Health Service, Dr. Tennant has also served as a consultant on pain treatment to the FDA, National Institute on Drug Abuse, the NFL, NASCAR, and even the Drug Enforcement Administration, or DEA. He has authored more than 300 scientific articles and books on chronic pain treatment and continues to lecture on the subject nationwide.
The CDC guidelines, I realize, are controversial and they are very condemned in some circles. Frankly, I support those guidelines. In primary care medical practice, it is relatively uncommon to have to go above that 90 milligram level. In all honesty, somebody who wants to prescribe above that is going to have to be a physician or a surrogate who's had special training.
When we spoke to Dr. Lee, one thing we wanted to know was how pharmacists in particular can play a role in both curbing the opioid epidemic and in ensuring patients who do receive legitimate, medically justifiable opioid pain prescriptions are managed safely. Here's what he had to say.
The most important thing that pharmacists need to consider when they're treating patients for chronic pain and using opioids are probably the potential for addiction. Pharmacists and physicians certainly should have a mutually beneficial relationship. Primary care docs, if they are writing scripts and patients are filling them at one specific pharmacy, should develop a relationship with that pharmacist.
We've now heard from multiple clinicians on how the prescription opiate abuse epidemic came about, as well as what must be done to prescribe and monitor prescription opiates safely. We have also heard from patients from across the spectrum in terms of how prescription opiates can either be beneficial or harmful, depending on how they're used and why. It's time to go back to our pain and addiction management specialist, Dr. Sprintz, for some closing remarks on what the future holds for opioid prescribing in the United States.
Primary care providers should get basic education on addiction medicine, meaning the basics of evaluation, understanding what the disease process is, how it presents, and then who are the local people that they can refer to in that area that have experience in managing or treating addiction disorders. At the same time, understanding the basics of pain management is important. Go take some courses either in person or online to really understand it, because in the end, the benefit of understanding these issues as a primary care provider is you'll feel more confident having these discussions with your patient. You'll feel more confident about when to refer and when not to. And you'll also know the providers in your community